Production and distribution of City Club forums on IdeaStream Public Media are made possible by PNC and the United Black Fund of Greater Cleveland, Incorporated.
Hello and welcome to the City Club of Cleveland, where we are devoted to creating conversations of consequence that help democracy thrive. It's Thursday, October 17th, and I'm Ariana Smith, Educational Engagement Manager here at the City Club. And I am pleased to introduce today's forum, which is the Medical Mutual of Ohio Endowed Forum on Healthcare. Today's speaker, Dr. Ayla Stanford, knew she wanted to be a doctor by the time she was 8 years old. But role models were few and far between in her working class North Philly neighborhood. Her teachers were dismissive, and the realities of racism, sexism, and poverty threatened to derail her at every turn. Nevertheless, thanks to her faith, family, and the sheer strength of her will, today she is one of the vanishingly small number of Black women surgeons in America, and an unrelenting force in the fight for health justice. In her new book, Take Care of Them Like My Own, Dr. Stanford shares an unflinching account of her story, explaining how her experiences on both sides of the scalpel have informed her understanding of America's racial health gap, which takes a devastating toll on Black communities across the country, affluent and underserved alike. Dr. Ayla Stanford is the founder of the Black Doctors Consortium, a national leader in health equity, and a healthcare policy advisor, and a former regional director of the U.S. Department of Health and Human Services of the Mid-Atlantic, where she was appointed by President Joe Biden. Today, we will hear about the power of communities working together to take care of one another and the importance of fighting for a healthcare system that truly fulfills its promise to all Americans. Moderating today's conversation is Dr. Edward Barksdale, professor of surgery at the University of Chicago and chief surgical officer at Chicagoland Children's Alliance. Dr. Barksdale has been an inspirational leader and champion of racial equity and healthcare. Throughout his career, he has advocated against structural violence, and he characterizes this as being the root of healthcare problems in Northeast Ohio. If you have questions for our speaker, you can text it to 330-541-5794. Again, that's 330-541-5794, and the City Club staff will try to work it into the second half of today's program. Members and friends of the City Club, please join me in welcoming Dr. Ayla Stanford and Dr. Edward Barksdale.
Dr. Stanford, Ayla.
Yes.
Welcome to Cleveland. This is a city that I have often described as being at the precipice of hope, but this is where hope abounds. And although my job is in Chicago, my work, where I hope to add value, is here in Cleveland. So with that as a backdrop, Dr. Stanford, we've known each other for more than a quarter century. Yeah. And in fact, almost half your life. You have moved from being a protege to a colleague to someone that I look up to. But one of the things that I would like you to talk about to this audience, if you would, is the quote that I think I gave you a long time ago, that nothing splendid has ever been accomplished except by those who feel that they are superior than their circumstance. Not superior to people, but superior to circumstance. Yeah. Please talk about place and how it might influence who you become as a person and how you develop your purpose.
Wonderful. Dr. Barksdale, Dr. B, has always been the wordsmith, always. But I believe what you're alluding to is where you're born does not dictate what you can do and what significance you can have in the world. And I'm saying that specifically to the young ladies I saw in the bathroom that are going to change the world. They're like, what, me? Yes, you over there. Because when I see them, I see so much of myself. And I'm from Philadelphia, born and raised in an impoverished community, and where sometimes the expectations for a child in that environment were non-existent. But my exposure to achieve great things came from my mind. And because I did well in school, I was exposed to other things. And the more I saw that people were learning and thriving, I wanted that. I also recognized that my teachers tended to pay attention to me more when I was doing well in school. And so I say that to say that there are in Cleveland, like in Philadelphia, and everywhere in the nation, young people, I'll even say more senior people that need to be nurtured, that can be diamonds in the rough to be polished, and you never know how they may impact the life of you or the world. And I believe I'm an example of that through God's grace, and fortunately, because I was nurtured by someone right here, very young. In the beginning, where I came into an environment where not many people looked like me, and their expectations were sort of non-existent because they didn't know. But I was fortunate to have someone like Dr. Barksdale in my corner reminding me of what I was capable of just through watching him.
So thank you. I don't want this to be self-aggrandizing for me.
I know. I just said,
So,
I know.
You know, when we first met, and I don't mean just myself, but others of your mentors, when we first met in that city with a P down south, that's a bad word here in Cleveland, we were so moved by your grace, your courage, and your intention. And what most impressed me at that early age is that you could see things, you could feel things that many of us could not or would not see with regard to the future. How did you cultivate the vision for creating something that wasn't in many people's mindset? And then I want to get to how did the pandemic stimulate that?
So one thing, and I will say this to young and old, is I don't compare myself to anyone. I set my own bar for myself. I think comparison is the thief of joy. And when you're just working on being your best self, I believe everything else will come. And it's hard, especially young folks now, and everything's on social media, and you're trying to outdo and whichever. But I honestly believe that, and I didn't know what my purpose was, but God had moved me from so many challenging things in my life and my upbringing that I didn't believe He had brought me there to leave me. And so when I had tough days, I mean, I used to recite Psalm 91 every day when I walked into the hospital, every day as I walked in. And that's where a lot of the resolve, I would say, and the tenacity came from.
Yeah. So, you know, often when we come to events like this, and when we look at people who have achieved as greatly as you are, we see them on the top of the mountain, and we praise that ascent. You've been very transparent in this book. And I've known you when it seemed like there was no light and there was no joy. Mm-hmm. So tell us about the valley, the valleys in your personal and professional life, and what did it do for you that you could communicate to others that would help them be stronger?
So I'll talk about one personal and some professional. I'll do the professional first because the personal is harder to talk about. The professional was more, you're working, and someone says, great job, you did a great job, I'm so proud of you, blah, blah, blah. But then when it's time for you to get your evaluation or your report card, what's written, what lasts, says, needs remedial teaching, would not advance, and things like that. And so if you didn't pay attention to what you were reading and you just signed it, it would, in essence, say you agreed with what was there. And so I went through that a lot. And it can rock your confidence, make you feel like maybe you really don't belong here. But again, I just went back to God didn't bring me this far, because I knew what was waiting for me at home in Philadelphia, which was a whole lot of not, at the time, positive things for me to go home to. I didn't want to be a statistic. I knew I could do something more. And so I pressed. I cried a lot, not in public. I prayed a lot, not in public. But I don't know. I'll just. Yep. So the growing up, you know, my parents were young, and they worked. Like, I felt like my mom went to work when it was dark. She came home when it was dark. And it left my brother and I alone a lot without supervision. Literally, we had our keys around our neck. You know, we took public transportation. I would get in fights for him after school, kind of thing. That's back when you had a fair one, not when people had knives and guns, but you literally fought, and then it was hopefully over. But there were people who came in our space that touched me in ways they shouldn't. And I was, I mean, it's even hard to say, I wrote it on the paper, but molested as a young child. Before you really know what that means, like, you're not supposed to feel certain things before you're 10 years old, right? And it's very confusing. And then I think sometimes when you grow up in certain situations, children protect their parents. And it's not supposed to be that way. Parents are supposed to protect their children. And so then it became this, well, why didn't you say anything now that we're all grown, you know? But back then it was I was trying to protect my mother. And so I did things, and I talk about them sort of graphically in the book. And the reason I do is because that's a lot of people's reality, but they don't talk about it. And it impacts relationships. It impacts, intimacy, how vulnerable you can or can't be. And for me, when I was in medical school, you had to learn how to treat someone who was a pedophile. And I'm in my class and I'm doing psychiatry, and in comes this person who was a pedophile, who was justifying his urges. And I had suppressed that part of my life. And now I'm sitting in class and I'm having all these flashbacks of this time in my life. And it was tough for me. I couldn't sleep because every time I went to sleep, I would see it. It was just mentally and physically exhausting. And it forced me to address it for my personal, just mental health and well-being. And again, I mention it because I have friends where you hear people talk about not moving beyond, but I was able to move beyond. And that's why I put it in the book, because I was. But then it forces you to have relationships, conversations with the people who were supposed to protect you once you get older. And that's tough stuff, but that's the real work.
Let's move forward and think about how this made this person that I admire and so many in the world admire, the CNN hero, the George Bush Award. As you know, I'm very fond of the Hemingway quote my grandmother would read to me, that the world breaks everyone.
Yeah.
And afterwards, many are stronger in the broken places. And that combined with this kintsugi artwork, which you know I have, these broken pots that are filled with liquid gold to make them more beautiful. You epitomize that kintsugi art. So even though you were broken, there were people who I think were purveyors of hope for you. Could you talk a little bit about the importance of mentors and sponsors in helping to heal a person who was fractured, who the world doesn't see as necessarily fractured? So can you talk about mentorship?
Yeah. So, and this is where representation matters. When I left Brooklyn and I got to Pittsburgh, I was fortunate that there were many attending surgeons that looked like me. Like, it was the only place in the United States where I landed. And it wasn't like, you know, people saw me and they were like, hey, how you doing? You're black, I'm black, let's hug. It wasn't like that. It was just seeing someone in the hall and them seeing you, right? And because they were there, and this was like 90s, 2000, and they were the first, I knew that everything I did reflected on them too. And so there was this tough love, I would say, not Dr. B, but my other mentor. I didn't think he liked me for like 10 months. Like, I don't think he smiled in my direction or anything.
That other mentor was my best friend.
Yeah.
We're alter egos.
He like didn't, I was like, I know he brought me here, but I don't think he really likes me, you know, kind of thing. But they were striving for excellence in everything. And there was this motto that I used to have from my church that said, excellence honors God and God honors excellence. And I thrived with that. And as I watched you and I watched Dr. Ford and I watched others, I was like, that's what I want to emulate. And so when I had challenges, you could talk about a lot of things, but you couldn't talk about my work ethic. You couldn't talk about my standardized score that I received after I learned how to take a test, which had to be taught to me how to take because I didn't learn in my public school education. I thrived. And again, it wasn't, you know, people think that there's like a secret handshake and it's all this stuff, but it's just literally seeing someone else clear hurdles that you're trying to clear that lets you know you can also do it. And so I had that through my mentors, I had it through my church family, I had it through my family where I was the bright light that everyone was like, wow, look at Ayla. Wow, look at Ayla. You know, quick story, when I graduated from medical school, my dad rented a bus, a Greyhound, and a driver, and he parked it in the parking lot in the mall in one of our neighborhoods so that people didn't have cars or whatever. They could get a bus to the parking lot or they could park their car and not have to worry about paying for parking all day. And my whole family in the neighborhood, they all got on the bus when I graduated. And they were so proud, I feel like, because I was the first doctor in our family. And it was like when I walked across the stage, they all walked across with me. And when I was in college and I would come home for Christmas and Kwanzaa, I remember, you know, I would give these reports. Well, this year I learned this, and this year I learned this. And I was saying, I got to take this test called the MCAT, and it's hard, and I don't understand it, and I need to take a class. And the class cost $1,500, which was a lot of money. And I remember someone in my family just taking off their hat and passing it around the room. And everybody putting $5 and coins and checks and all of this. And I took that back to Penn State, and that's how I paid for my class. And obviously, it worked out well for me.
Yeah.
But Yeah, so that's my
Yeah,
my
no.
family. Wow.
So I think I'm in trouble for exposing or making you so vulnerable, but in front of my friends. But it's that vulnerability that has always made you human to those of us who've mentored you. I'd like to move a little bit forward toward thinking about health and healthcare, and thus health disparities.
Yeah.
It is not alien to anyone in this room that Cleveland, much like Philadelphia, suffers heavily under the weight of the social determinants of health. And for those of us like me who are so heavily biased toward children, I think some of the disparities start in childhood. Sure. Can you talk to us a little bit about health disparities from your perspective and your experience, and toxic stress, and what we can do to address them? This is a mouthful, but if you could in a concise way, because I want to then get to, give us time to talk to, what would make a pediatric surgeon think that during a global pandemic that she could leave her practice? So don't get to that, but I want to save time.
Okay, that's
Dan's
the last
looking at me. He's eyeing me. But I want to make sure that but if we can talk about toxic stress, children vis-a-vis health disparities in the community.
So Philadelphia is a great example of this. When I grew up in Philly, and some of this is still true, we had 2 children's hospitals. We have St. Christopher's Hospital for Children, and we have Children's Hospital Philadelphia. And any of you who have been to Philly, St. Chris is in the hood. It's not uncommon for people to get their cars broken into, and so forth. And CHOP is like this booming metropolis, and there's buildings and skyscrapers everywhere. There's like restaurants in the lobby. I mean, it's a beautiful palatial place. When you're born in Philadelphia, depending on the type of health insurance you have, dictates which hospital you can go to. So when you talk about health disparities, it's like when you're in the womb, it's before the baby even comes out, that you walk into, as a parent, into one hospital where there's beautiful artwork hanging from the ceiling, there's a radio station in the lobby where you can do a podcast, there's all these things, and then another place is struggling to make sure they have all the supplies. And the folks are stressed because they don't have all the resources. So that's just one example of what it looks like systemically, what it looks like. The other is an ambulatory care center or a subspecialty medical office in your community. So where I live in the suburbs of Philly, you know, I can take my kid to get a cardiology appointment, to get an MRI, to see a GI specialist, and everything. Walking distance from my house. I could walk, I could ride a bike. If you live in an impoverished community, those places don't exist. And it's largely because the institutions invest in communities with better payer mix, right? So it's one of those things where, yes, I have insurance, but how does your insurance reimburse? And if it doesn't reimburse at a high level, then you're not going to get all these specialty places in your community for children. The toxic stress part is why young Black men at 16, 17, and 18 already have hypertension. It used to be that high blood pressure was a result of having, you know, calcified blood vessels and coronaries and cholesterol from eating, you know, steak and McDonald's and all this kind of stuff. But now it's just the toxic environment and stress because they haven't lived long enough to have that buildup, right? It's why we have, you know, premature babies being born. It's why now I believe that you're seeing certain cancers more rapid. And so what that looks like, in addition to having better facilities in your communities, I think would work towards eradicating health disparities. It's also removing the bias that we know exists and how the health care is delivered. And when people ask me how we get there, it's by taking care of them like your own. Like the title of my book is how we get to the best health outcomes, is that you're caring for someone like your brother, your sister, your spouse, your child, not like an other person, but more like someone who is like you that you care for.
So, that's phenomenal. This is a very special place for me, the City Club, because a long time ago when I didn't know about this place, there was a speech given here the day after Martin Luther King was assassinated by one of my most favorite political figures. Make sure you get it correct, RFK, not RFK Jr. And the quote reads this way, and I want to use this as the lead-in to why you thought you could change the world in Philly. And that quote from RFK, and forgive me for reading it, I should have it committed to memory. For there's another kind of violence, slower but just as deadly, destructive as the shot or the bomb in the night. This is the violence of institutions, indifference and inaction and slow decay. This is the violence that afflicts the poor, that poisons relationships between men because their skin has different colors. This is a slow destruction of a child by hunger and schools without books and homes without heat in winter. Use this often in my talk. So can you address why, when a global pandemic occurred, that you took that message that actually kind of occurred here in Cleveland, metaphorically in this place, and it became a call to action for you?
Absolutely. The indifference, and just as that's a fascinating intro. We didn't plan, so I love that. The indifference and what I saw in Philadelphia, and you heard born and raised, growing up as an adult in Philly is totally different than a kid. Like, I'm experiencing things now that I didn't even know existed in my city, because you just don't have access to it when you're younger. When people were getting sick in March of 2020, they were all calling me because I was a doc that they knew. And they were saying, I went to the hospital and they sent me home. I said I needed a test and they told me I wasn't sick enough, and all of these things. And I was calling my friends at the hospital, like, are you really turning people away? And they said, well, their doc's not on staff here. Or, well, they're not covered. We don't take their insurance. Or, or they walked or took a bus and we're only taking people in cars. I'm like, do you hear yourself? Like, this is, or we could only test the parents but not the children. And that indifference or lack of a sense of urgency is what made me say, I'm asking people to do a test so that they can support themselves, so they can not spread it to others, and do the best they can to have the best chance. That's all we had in our armamentarium. And after I asked enough people and I was getting nowhere, I said, well, I'm a surgeon with my own practice, with accounts with LabCorp and Quest. I'm just gonna go to where the people are. And because it was Black people that were dying at a rate 3 times greater than everyone else in the city, I went to where Black people trusted, and that was the Black church and the mosque. And through my pastor, reached out to other pastors and said, all she needs is your parking lot. Can you give her the parking lot, electricity, and the bathroom for her team? And with that, we started testing 400 to 600 people a day. And meanwhile, the hospitals were doing nothing until the CARES Act was passed. Then the CARES Act brings money, and there's $640 million coming into the city, and now Jefferson and Penn and Temple are having all these pop-up places. But prior to that happening, they did nothing. And I can't imagine, I shouldn't say they did nothing. They didn't do a lot. And I can't imagine that I had more money in my bank account, child on public assistance growing up, who is new generational wealth, if you will, and I wouldn't even say that yet, but anyway, had more money than all of these institutions. And so why I did it is because I knew that I could, and the answer I was looking for, I was equipped to have. And we just kept going and kept going. And then when the money ran out, all those places shut down again. And we were the only ones that stayed open because the community had come to rely on us because we were present and we were persistent and we went to them as opposed to saying, we're open. If you want to come and get health care, we're open 24 hours a day. No, we went to them because we recognize the trust factor that's important and is often lacking. And I never say people of color don't trust the healthcare system. I say the healthcare system has been untrustworthy to people of color, and that's why you have to work hard to earn the trust. And so that's what I feel like am teaching. I'm a catalyst for that. More people are like, okay, Ayla, you got that right, and yes, we could have done more, and I hope it serves as an example so people stop making excuses and putting up unnecessary barriers when they don't have to be there, and so that's the why.
Well, that's great. Well, we are at our point where we're at 5 minutes. I just have one thing to add before we open for audience questions, is that you have always been a ferocious warrior. And I think this audience would recognize that. And, as it's been said, the real warrior fights not because of the hate for the enemy in front of them, but the real warrior fights for the people they love behind them. So I want to thank you for being that ferocious warrior that stopped looking at the racism and structural violence, but started looking at the people who needed someone like you to step forward, and not just to defend them, but to care for them like they were your own. Thank you.
We are about to begin the audience Q&A. For our live stream audience or those just joining us, I'm Ariana Smith, Educational Engagement Manager here at the City Club. We are joined by Dr. Ayla Stanford, founder of the Dr. Ayla Stanford Center for Health Equity and author of the book, Take Care of Them Like My Own: Faith, Fortitude, and a Surgeon's Fight for Health Justice. Moderating the conversation is Dr. Edward Barksdale Jr., Professor of Surgery at the University of Chicago and Chief Surgical Officer at Chicagoland Children's Alliance. We welcome questions from everyone, City Club members, guests, students, and those joining us via live stream at cityclub.org. If you would like to text a question for our speaker, please text it to 330-541-5794. Again, that's 330-541-5794, and the City Club staff will try to work it into the program. May we have our first question, please?
We have a text question. Just this week, Walgreens announced they are closing 1,200 stores. This is on the heels of Rite Aid filing for Chapter 11 bankruptcy, closing almost every single store right here in Northeast Ohio. Can you talk about how these closures are impacting low-income communities and the role of access to pharmacies has in your health justice work?
It's devastating, and it has happened in Philadelphia as well. We are working on bringing a pharmacy into my ambulatory care center, but for seniors especially, and the young that have to take multiple buses to get to a place to fill their prescription. And this is, everything is governed by money. It drives me crazy. It's no longer about the care that the person needs. So CVS, because they're the main ones that are buying up and the only ones that are still viable, have started, doing shots, doing therapy, doing all these extra services, not just delivering medication. But they're all in affluent communities. You're not gonna find any CVS in a place where the life expectancy is low. And so I even looked into buying a CVS, and they won't allow, you can't franchise a CVS, right? I looked into that. And so it's a real concern. What I would say for the people in this room is that as you're discharging your patients from the hospital, or as you're seeing them in clinic and you're writing a prescription, to make sure they can get it filled. If you can get it in the hospital, to give them a week's supply at a time so they can pay for it and come back in a week, you gotta do that. So it's no longer that you write the script, give it to them, and say, good luck getting it filled. That's what I mean when I say we have to take that extra step and ask, is there a pharmacy that's open near your house that accepts your insurance? And if not, that person doesn't leave your office until you have a solution for them.
Knowing what I know, you'll have some CVS franchises.
I'm working. Listen, I am trying. It's hard to break into it.
You'll break them down.
All right.
All right, I'll keep going. We've got another sex question. They're rolling in.
Okay.
Do you think the universal health care would solve the disparity problems in the delivery of quality health care?
No. No. That's where the providers, and I mean everyone from the receptionist to the nurse practitioner, physician assistant, doctor, surgeon, and CEO and CMO of the hospital have to look in the mirror of how they are delivering care. You can't teach someone to treat someone, let me back up. You can teach someone, some of it is innate, to treat someone like they matter. And they're not just a bottom line for reimbursement so you get to your bottom line. And so having access to care, or that you can schedule an appointment, doesn't make someone treat you with respect. That's you gotta look in the mirror. And I keep saying, if you're trying to figure out what to do, take care of them like my own. I'll get to a point where hopefully there is no my and no there. It's just we're all existing here together. But that, you can't, the being able to see a doctor doesn't make someone sit down when you go and see your doctor. It drives me crazy when you see a patient sitting and the doctor is standing up the whole time. What that says is, I have somewhere else to go, that it's not important that I sit down here and look at you at eye level, that are on their phone, that are on their computer, and they're not listening and they're not present. They're in the room, but they're not present. And so what I say to that is, all of us that deliver care, that create insurance policies, whatever you do that involves a patient health outcome, we have to look at what that looks like. And that's where you get to best health outcomes. Certainly being able to have an insurance card matters and get an appointment matters, but the stuff that we really need to change is that inward look at the one providing the care.
Yeah, my name is Dr. Charles Maudlin. First of all, I'd like to thank Dan, Cynthia, the City Club for bringing you here today to talk about this very important topic. So I'm a urologist at Metro Health. Been at Metro for 3 years. I previously spent 28 years at Cleveland Clinic as a kidney transplant surgeon. And I, along with a number of colleagues, were fortunate to be able to start a number of health equity initiatives, specifically aimed at minority and underserved populations to address health disparities. And I'm particularly disturbed about a movement that actually is occurring across the nation, pushing back on DEI initiatives. Specifically, understanding the causes of a lot of the social determinants of health and predisposing factors to the healthcare disparities. We set out to create a number of impactful programs to where we could more effectively address the health disparities and actually engage minority communities. And in doing so, for example, some of the programs, we would put the word minority onto our program. Minority Men's Health Fair was one program that we started, and a number of other programs. But the movement that I see in the nation is actually even lawsuits. I'm not going to go into specifics. Have targeted certain programs that actually are trying to project to the community that these programs are specifically designed for you, your specific healthcare needs in mind. And they're taking the word minority off. which actually negatively impacts our ability to effectively engage these populations. When you put a word such as minority, multicultural, diversity, it actually helps create a more trusting environment and relationship between the target population that you're trying to reach and the healthcare providers. So this question is directed to you, Dr. Stanford, Dr. Barksdale. What do we do collectively to push back on this negative movement that is going to threaten our ability to reach these target populations?
So, wonderful question. First, the reason why, and you're absolutely right, I named our organization the Black Doctors Consortium was on purpose because I wanted the name to connote a certain level of trust. In terms of what we can be doing, it has to be twofold in that you need your scholars, your lawyers to be fighting that fight. The health people have to be doing the health work. I think ways you get around it is it's a particular community. So in Philly, it might be North Philly that is 70% African American. So it becomes the North Philadelphia Men's Health Alliance, right? Okay, if you're white and you live there, great. If you're Black, then you just have to be creative. Or it's, a certain neighborhood alliance or the zip code alliance, right? 19132 or whichever alliance, and people will get it. I agree, it's not the same as saying that, but there are other ways to be strategic about it. It could be, were you a such and such high school grad? And the majority of the people that came out of that high school is the community that you're targeting. I was listening to an interview yesterday with Charlemagne the God and the vice president, and it was geared towards Black men. And someone said, well, you're the president for everyone, and why are you just focused on Black men? And she said, well, it's known that Black people in America are 40% less likely to own a home. And so this program that I'm putting forth is for anyone who is a first-time homeowner. However, if you happen to be one of the people who don't own a home yet, then you can benefit regardless of what your color is. However, in this country, wealth is linked to home ownership. Home ownership is linked to education. Education is linked to health outcomes, and health outcomes are exacerbated by racial injustice. And so it's for everyone. The last thing I'll say is that by year 2050, half the US population is going to be people of color. So you can decide that you don't want to focus on inclusivity and belonging programs and not pay for preventative care, but those folks are going to need ICU care, tertiary care when their diseases are advanced, and there's only so many hospitals and so many doctors in this country that it doesn't matter how much money you have. If you can't get to your doctor because they're taking care of all the folks that you didn't want to take care of once upon a time, it'll either hit you on the front end or the back end, so you choose. But my take home is the doctors, you keep doing your work and you get the lobbyists and the lawyers to address the arguments that are out there.
I don't have an answer, but I have a statement. I'd like to thank you, Dr. Maudlin, for being at the front of the line, the vanguard for health equity and justice in this community as a physician for more than 3 decades. And so I just want to tell you, thank you for your work.
I thought I was taking my oral boards when he got to the microphone. I was like, uh-oh, I don't know what he does. But you see, I changed my posture. I was like, okay, I got to listen to every word because this is going to be tough. Sorry, go ahead.
Good afternoon, everyone. My name is Trey Armstrong. I'm a second-year medical student at Case Western Reserve University School of Medicine. First and foremost, Dr. Stanford, I want to say that you've been a role model for me, not only because you're my mother's sorority sister, but also just watching the work that you've done over these last few years. It's been really inspirational for me as I've pursued medicine, and so I just want to thank you first and foremost. Secondly, my question is, as a future healthcare provider, how do you balance choosing a career specialty to provide for your family, pay back your loans, things of that nature, but while also looking to reach back to your community and those who look like you?
Oof, all right. All right, young Dr. Armstrong, let's see. Your specialty has got to be what drives you. And I know people say this all the time, but that you would do it for free. That you just love getting up. For me, I just loved operating. It's my sanctuary. It's where my phone was turned off. There was no one more important than the person on the table and my people around me, right? And that you could create the vibe. If you came in and you're in a good mood, you put something nice on, everyone's flowing, it's working well together. For me, the OR and honestly, an empty church are the two places where I have the most peace.
Sanctuary.
Yes.
Sanctuary.
Oh, that's right.
Sanctuary.
Yeah, where I have the most peace. So in doing that, I was fortunate that it was enough to also take care of my family and enough to do all the things, to have everything I needed, and at this point, everything I also want. So I would say to you, I wouldn't choose it because someone is saying you need to go back to your community, because honestly, if you choose not to do that, that's not, do you know what I mean? And I don't feel like the onus, the responsibility should be on you to fix a problem you didn't create. I really don't believe that. But if it's in your heart to do it, then you do it. The money will come. And no matter what, right? In medicine. And then in terms of giving back to your community, you may be the one that's grassroots, or you might be the one that gives to a nonprofit with a donation. And one is not more important than the other. So I wouldn't let what you see me do, what you see others do, dictate what's for you. It's gotta be what's in your heart and makes you excited to get up every day and do it.
Hello, my name is Sissy Watkins. I am a doula, CHW, and a lactation educator here in Ohio. I'm not an Ohio native, but I became a parent here, and so my career kind of changed trajectories after having my kid. And I am so thankful for the work that you've done and the message that you shared, and I can't wait to read your book. I actually followed you on LinkedIn before today, and I didn't realize it until you were up here, so I thought that was really cool. But I did have a question. So a lot of what is happening in healthcare is recognizing that we need all the parts to support somebody, mind, body, and soul. And so I would love to hear your thoughts on implementing more community health workers, implementing that preventative care and that follow-up care that is just not time manageable by physicians and by nurses, and then how organizations, whether it be a small clinical setting or at a major hospital, can implement those.
Okay, first, thank you for being a doula. Thank you for being a doula. The service that you provide for women is life-saving for them and for their child. To be a voice, to be an advocate, to be a comforter, so that maybe joy comes back to being pregnant and giving birth, where I feel like there's so much fear now. So I just wanted to say thank you for that. I didn't talk about it, but I built an ambulatory care center because all of the people that everyone else turned away during COVID that weren't insured, when the CARES Act was passed, I could bill for them. And I had enough PHI that those $50 tests, which typically wouldn't be a lot, $50, $25 reimbursement, it's a lot when you do 50,000, right? And so I made over $1 million. I took that money and reinvested it into 19132, lowest life expectancy in Philly, and built an ambulatory care center in the hood. And it is, I think, Dr. Barksdale has been there to visit, It's beautiful.
And my son
And
works
his son
there.
has come to volunteer. And I live in the suburbs, my landscaper came and put grass all over it and everything. It needs to be welcoming and beautiful, not like a sterile city clinic. Now, in my place, we have GYN, we have a psychiatrist, we have therapists, we have cardiology, we have primary care, we have pediatrics, we have nutrition, and we have social work. So when we get our patients in, we try our best to take care of everything, to be one-stop shopping for them and for their children. So much so, last Friday, we had our mobile mammogram unit, and when the women came in, yes, they were coming for mammograms, but we did health screening, we did SCOH screening, we diagnosed other things before they even got to their mammogram. And so I personally think that that's how you get to it, is that people have so many other pressures and other responsibilities that when they come in to see you, you need to be ready to receive them and find out what their needs are and meet them, but also ask questions. That's another thing. Folks, you go to the doctor now, it's like, you here for that? Okay, you're here okay, good. That was a quick visit, you're out. For us, I know, again, how hard it is to get off work, to be there, to bring your kids to whatever. So when they come, we just get everybody in. Okay, yes, you're here for GYN. You need to talk to somebody about your what? Okay, you can go speak to our social worker. And so it's doable. And in terms of the cost, social work students have to do didactic on-site, work. And so right now we have social work students that rotate through, PA students and nurse practitioner students, and they are allowing us to extend our reach and provide a great service. They are information gatherers, not information processors yet, but just them gathering the information and presenting it to us allows us to help others. So you're right on point. It needs to all be. And so I try to lead by example and say, if I can do this here, you need more. But so many of them are in affluent communities like the CVS's. They're not coming to our communities. And so you either need to advocate very strong to get it in the community or build your own. That's it. Thank you.
Thank you.
Good afternoon. My name is Ron Kistner. Let me first say that this gentleman who was up here a few moments ago, Dr. Modlin, is also a rare for an African-American kidney transplant surgeon who put a kidney in me 8 years ago. So, Dr. Barksdale, I met him when he first came here to Cleveland. I did not know you were in Chicago. For you movie buffs, I'll tell you a little scoop. He's on speed dial with Angela Bassett. So they went to school together. So that's a little bit of news you can take from here and spread it. Dr. Stanford, thank you for your vulnerability and your realness. It's very rare to get any public speaker to be as vulnerable and real as you've been today. I heard you on Fresh Air, and you were very vulnerable there. You talked about your hand situation, carpal tunnel, that now forbids you from being a practicing physician anymore, and now you're more an activist. And I want to ask you about your work that you're doing with the Black Doctors Consortium. Would you please talk a little bit more about how it's constituted? I think you said, did you say it was national? Or, okay, could you really talk a little bit about the work that you're doing with that group?
Okay.
Thank you.
Thank you for your question, and thank you for saving him. And let me preface by saying I can still operate. I don't want you to think that I can't. I did have bilateral carpal tunnel surgery, which was devastating. And I was walking around with bandages on both wrists, and people are like, you okay? I mean, you really okay? But yeah, I operated a lot after that. So the Black Doctors Consortium, because I had my own private practice, I already had the infrastructure. I was already in network with all of the health insurance companies and with Medicare and Medicaid and so forth. And 10 years prior, I started a nonprofit called It Takes Philly, encouraging and empowering our children to aim high. So I was already doing mentoring and so forth in the city of Philadelphia. And that was because my chief of surgery some 10 years prior said, I'm not paying you to give inspirational lectures to children, I'm paying you to operate. So I created a nonprofit so that I could bring all my friends in and go and talk to children in schools, and I could also raise money as a nonprofit. All of that came together during COVID because I had my own for-profit, because I had my own pediatric surgery, and I had my own nonprofit that I had started some 10 years prior. And so I was able to bill as an insurer, and I was also able to apply for grants as a nonprofit, which is every healthcare system model, by the way. They're nonprofits, so they don't have to pay taxes, but they're for-profit, so they can generate revenue. Anyway, I hope there's no administrators in here getting mad at me. But basically, you know, that's what it is. That's how they build lots of things and they don't pay tax. Anyway, so that is my model. It is in Philadelphia right now. There are other people with similar ones, but what I hope to do now that I am at the University of Pennsylvania is create that template that it can be duplicated across the nation. People have similar things, but it really takes someone stepping out and being, and taking all the hits and all the risk, which I have done. A lot of folks, when you're associated with an academic institution, if they don't support you 100%, it's hard to do it by yourself. And so that's how it's created. And thank you for listening. That fresh air, Terry Gross is a tough interviewer. She had me crying. She was like, do you need a break? Do you need a break? Yeah.
Can I just say something really quickly? If you read the book, you won't care about who I have on speed dial. You'll recognize that Will Smith has her on speed dial.
Oh yeah, I forgot about that little piece.
Thank you very much to Drs. Ayla Stanford and Edward Barksdale Jr. for taking the time to engage in this important conversation at the City Club today. We also extend our thanks to our members and guests for joining us, whether in person or via live stream. Forums like this one are made possible thanks to generous support from individuals like you. You can learn more about how to become a guardian of free speech at cityclub.org. Today's forum is the Medical Mutual of Ohio Endowed Forum on Healthcare, as well as a part of the City Club's Health Innovation Series, thanks to support from Medical Mutual. It is also part of our Author in Conversation series, thanks to support from Cuyahoga Arts and Culture and the Cuyahoga County Public Library. We would also like to thank University Hospital's Rainbow Babies and Children's Hospital for their programming partnership in today's forum. The City Club would like to welcome students joining us from the Innovative Center at Shaker Heights High School. We would also like to welcome guests at the tables hosted by Case Western Reserve University's Clinical and Translational Science Collaborative of Northern Ohio, Medical Mutual, the Northeast Ohio Black Health Coalition, Metro Health, and University Hospital's Rainbow Babies and Children's Hospital. Thank you all for being here today. Tomorrow at the City Club, we will hear from the Ohio State University's president, Ted Carter. And then on Friday, October 25th, we will hear from Pronita Gupta, former special assistant to the president for labor and workers on the Domestic Policy Council in the Biden White House. She will be discussing the role of coalitions and partnerships in rebuilding the economy. You can get tickets for each of these forums and learn more about others at cityclub.org. And that brings us to the end of today's forum. Thank you once again to Dr. Stanford and Dr. Barksdale. I'm Ariana Smith, and this forum is now adjourned.
For information on upcoming speakers or for podcasts of the City Club, go to cityclub.org.
Production and distribution of City Club forums on IdeaStream Public Media are made possible by PNC and the United Black Fund of Greater Cleveland, Incorporated.